Okay, we got. Well, good morning. I'm Joe McComb, Mayor of the City of Corpus Christi, and I think we've got some great news to tell you. And we have the folks that can get into the details with me, and we'll introduce them in a second. But it's hard to believe this is March the 22nd, 2020. It's the first case of COVID confirmed in Nueces County. That was 262 days ago. And today we're here to share with you that there's a vaccine that has been developed in a record time. And if you don't believe in miracles, well, this vaccine is a miracle of the human spirit. And so we're delighted that we're going to be getting this. And my thanks to Judge Canales and the work of herself and Peter that really kept reminding people that Nueces County, Corpus Christi, needed it, and we're one of the first to get the original or initial distributions, and we're going to continue to get because of their efforts. And I don't know where the judge is. Right here, sir. Thank you for your effort, and Peter and others on the team, Annette. But this is an exciting day for us. Two things I think are going to be important is to one, when the folks that are here with me today listen for the details and take a big dose of patience, because we're dealing with big numbers, and taking vaccines and getting the information and getting organized is quite a logistical effort. And so be patient. If you're not the first one in line or you don't get it the first day, we're going to continue until we get everybody that wants a shot. You're not mandated to have them, but we'd highly recommend that you get them. But it'll be patient. And so there'll be enough for everybody that wants one. It just may not be on the day or the time that you want it. But the folks that are going to be administering this are doing their best, and they need to do it right. You don't want any mistakes made. And so we hope that you'll demonstrate some patience and appreciation for the effort that they're going through, and you'll be safe for it as a result of it. But joining me today are Assistant City Manager Steve Vieira, Nueces County Judge Barbara Canales, Public Health Director Annette Rodriguez, and Deputy Fire Chief Richie Quintero, and Assistant Fire Chief Ken Urban. And we're here today to give you the latest information, and they will get the details in their presentation of the vaccine that are going to be arriving on Monday, January the 11th. And they will be going into the details again of who is eligible to get this round of vaccination, how the vaccines will be administered, the locations, and who is eligible, again, based on the priority list that has been established. We want to try to get to the people that we feel like are the most vulnerable first, to try to protect as many people as we can. The locations, they'll discuss that, where the rounds are eligible for individuals that can pre-register, how you pre-register, and what role that the fire department is going to play. And one way we're being able to move this process forward a little faster is because of the professionalism of our folks in the fire department and their abilities to assist in the administration of these vaccines. So we're delighted to be working together as a county and the city, and everyone working for the best interest of Nueces County. And so we want to take advantage of this opportunity to thank them, but encourage you as the public, again, to, when you are given the instructions on when you can apply, where you can go get the shots, to do that. But that's the reason that we want to make sure that you pay attention. And one of the main things that you need to do to make it effective, and they'll go into that, but I just want to remind you, because repetition sometimes is the best way to learn. This is a two-step process. You're going to get the initial vaccination, and then there's a follow-up vaccination within a few days or a month. They'll give you the specifics on that. But you've got to make sure that you follow through on that if you really want to have the full protection. And so at this point, I'm going to stop and allow Gabby to give us the Spanish translation, and then Judge Canales will come and begin to share as they say, the devil's in the details between what the judge has to say in that and the fire chiefs. Then we'll open it up for the press for questions. But this is an exciting day for Corpus Christi, Nueces County, and it seems like it's been a couple of years, but based on my calculations, it's only been 262 days since we had the first case. So we hope that it doesn't take that long to get everybody vaccinated and have this thing whipped, and we can be on our way back to normal. So, Gabby, and then Judge Canales.
El 22 de marzo del 2020 se reportó el primer caso del coronavirus en el condado de Nueces y ahora, como un milagro y en tiempo récord, ya contamos con la vacuna. Hoy le vamos a dar los detalles, pero tenga paciencia. Si no es usted uno de los primeros en la fila, sea paciente. Habrá suficientes vacunas, pero va a tomar tiempo. El día de hoy me acompañan el administrador adjunto de la ciudad, Steve Vieira, la juez del condado de Nueces, Bárbara Canales, la directora de Salud Pública, Annette Rodríguez, el subjefe de bomberos, Richie Quintero, y el subjefe de bomberos, Ken Urban. Hoy le vamos a dar información más reciente sobre las miles de vacunas programadas para llegar al condado de Nueces el lunes 11 de enero. Le diremos quién es elegible para recibir esta ronda de vacunas, su administración, los lugares donde se van a administrar, la inscripción para registrarse en línea o en persona y el papel que jugará el Departamento de Bomberos de Corpus Christi para vacunar a las personas mayores. Exhorto a todos los residentes a que se vacunen cuando sean elegibles. En este momento estamos en las primeras etapas de la primera ronda de vacunas. Recuerde, todos necesitarán 2 dosis de la vacuna para protegerlos del COVID-19. Ahora la juez del condado, Bárbara Canales, nos va a dar su reporte.
Gracias, Gaby. We're not quite at noon, so it's still good morning to all of you. Barbara Canales, Nueces County Judge. Well, I am truly proud and happy to be here today with you, Mayor, and with Chief Urban, Chief Quintero, Assistant to City Manager Vieira, because we come together to share this great news. And this great news is that this Monday, as we announced last night, we will receive, sorry about that, 4,000 doses of the Moderna coronavirus vaccine. Now, you know there are 2 different manufacturers, and so it's important to know that there are differences. There's the Pfizer vaccine, the Moderna vaccine, and in probably very short order, we'll probably hear about another approved vaccine. But the one that we're talking about that we're going to receive is Moderna. And I will refer all those technical Moderna questions after my remarks are complete to Public Health Director Rodriguez, who can talk to you more about the specifics of Moderna. And as soon as we can on Monday, we will begin delivering vaccine to those people, and this is important, over age 65 and those over 16 who have illnesses and conditions that put them at great risk. This is what we deem those chronic conditions. Here are a few of those conditions, but this is not an exclusive list. Cancer, COPD, diabetes, heart conditions, sickle cell disease, pregnancy, and many others. We have the capacity on Monday, well, let me back up. We have the capacity to deliver 1,000 vaccines per day. Let me pause and go off script for a minute. Most likely that Moderna is not going to give us a full day of ability to vaccinate. So we're not going to be able to do 1,000 on Monday because I bet we don't get started until noon. It's going to be a half day because we're going to be awaiting that FedEx truck or whatever delivery service it comes by. But we have created a mega site, or you can call it a mega clinic. It is the COVID vaccination clinic at the Richard M. Borchard Fairgrounds. And we have these facilities in our county, and we are so fortunate. We have the trained and protected staff. We also have tested and refined our procedures, having vaccinated over 570 people at this very location just a week ago. This is also important. We have an immunized health department, thanks to Public Health Director. And these immunized health department employees will be working at the fairgrounds, along with emergency management folks from the city and the county, and we'll go into all our partners, and they are also immunized. So I have a metaphor for you today, and I greeted the mayor, although he didn't know the movie, so I'm disappointed. But I hope he goes and watches it. It's one of my favorites. And it's a baseball movie, and we're a baseball town, so maybe you will appreciate this. And if you're not, maybe you're a Kevin Costner fan. It's from the movie Field of Dreams. And the line goes something like this: if you build it, they will come. Well, we have built an incredible infrastructure here in Nueces County. And I'm not sure, Mayor, which day it was, but it was pretty quick after that first day in our 262 history when we started talking about doing a mass testing. And so we are experienced, and we have built it, and they are coming. Those vaccines are coming. And I'm proud of this teamwork that the mayor alluded to that went into this effort. I want to thank specifically the City County Health Department on behalf of the citizens of Nueces County. I want to thank personally the City of Corpus Christi. When Peter Zanoni, city manager, called me on Wednesday night about 9:30 at night, this is how I answered the phone. What's wrong? What happened? What's bad? He said, hey, it's good news. We've gotten so accustomed to a phone call in the evening being anything but. Thank you, Peter, for making that evening a good reminder that it's a new day, it's a new year, and so I should expect good news. And I want to thank, again, the City of Corpus Christi, the City of Robstown, whose jurisdiction we're in at the Richard M. Borchard Fairgrounds, and whose police department will be directing traffic alongside our constables, our sheriff's deputies. We might even have some DPS officers, of course, CCPD, without, I always get their rank wrong, but without, I would say, just Sherman and Breedlove, without our chiefs and captains, I just don't know what we would do, because they are our logistics and traffic control experts. And so we've demonstrated to the state of Texas, to Texas Division of Emergency Management, that we not only have a need for vaccines, but we have a larger vulnerable population than the Texas average. And we've also demonstrated that together, we believe we can deliver up to 1,000 vaccinations per day. Don't tell, I think we can do more, but I'm going to guarantee that we can do 1,000 a day. And we can help safeguard the health of our family, friends, employees, neighbors, and surrounding community. And so, because we have demonstrated that we have the ability to deliver, I also want to tell you that these will not, let me repeat, these will not sit on a shelf or in a refrigerator, because we are limited by staff, by space, by training, by protective equipment, or computer infrastructure, or physical infrastructure. We have it all. We built this together. And today we are announcing additional sites in the city where we will deliver vaccines for our vulnerable populations. And I actually have to change that because Annette told me, just whispered to me, that that is to come. So I'm not going to do it today. Again, let me go off script a little bit to explain. We have an amazing opportunity to utilize our Corpus Christi Fire Department in the upcoming days, maybe even weeks. But what we need to do is let them get their allotment. They're anxiously waiting, and hopefully they'll get it very soon. And when they get their allotment, we have jointly made the decision between CCFD, the city, the county, and the health department that we can find other sites like community centers or senior centers where we can have smaller outfits where CCFD can do what they do best: reach out, touch somebody, help them heal. And so I know that that is upcoming. We were hoping to do it today, but I think we are smarter and more prudent to wait for the fact that you got to get the vaccine before we tell you where we're going to go. But I want you to understand how far ahead we are in our thinking patterns. So I will continue to push to ensure we get Nueces County and our coastal bend neighbors the priority we need. And you should know that that mega site is not just for Nueces County. It's for a 75-mile radius to really help address our coastal bend needs. And I think that that's going to be very important and comforting and reassuring to our neighbors in San Patricio, Aransas, Jim Wells, Duval, and Clayburgh. Because the sad truth is that we have a population collectively that's more at risk than many other parts of the state. We have, as I said on our press briefing, but it's worth noting for the media, 50% more people over the age of 65 than the Texas average. So think about that. Who are we targeting in this tier? Over 65. What are we? 50% more higher than the Texas average right here. That's very compelling. We have more uninsured people than the Texas average. We have more low income. Our AMHI, annual median household income, lower than the Texas average. We have higher incidences than illnesses that make COVID a deadly disease, like diabetes and asthma and obesity, than the Texas average. We have more people, quite frankly, in the priority categories than any other parts of the state. Our need is clear. Today's good news is partly based on need, only partly. Why do I say that? We're all in need. I can't say that those living in different parts of the state aren't equally in need, because we know that they are. But my duty is to Nueces County and to demonstrate that need to the state, which we have. It's based on our ability to put our limited resources to use immediately. And again, I remind you that even with this good news, it may not be your turn to get the vaccine. Mayor, you said it perfectly. You're going to get a dose of some incredible mRNA, that messenger RNA, when you get this vaccine. But I need you guys to listen to what your mayor just gave you the best advice, and that's to have a dose of patience. Let me repeat. Even with this great news, it may not be your turn to get the vaccine, but everybody can do their part to protect the spread of the coronavirus. And by the way, your turn is coming very soon. It's not my turn either. You know what this means? Here it comes. The 3 W's. Wear your mask, wash your hands, watch your distance until it's your turn. And even when it's your turn, you've got to get a second dose. You need to keep those 3 W's active in your life. And even after you get your second dose, you need to keep that active in your life. And I'm standing right here as testament to the fact that our defensive measures, protecting us from getting and spreading the virus, along with these offensive measures, these 4,000 doses, plus the 570 we've already done and the 600 you all have already done. This is reason to be optimistic. And because I can say that, it gives me pride to stand with the leadership here, to my left, to my right, behind me, the mayor, Mayor McComb. It's again, forgive me for going off script, but 262 days, sir, with you has not only been important for the team that we built, but every time you said, I want to thank the judge, this old meanie wanted to cry. You make me want to cry today because I need to really thank you and all the people that you led. It has been a really tough time. And you got to work with people that you can know will stand by your side. And I will, because you would want me to. I'm going to work just as hard, just as fierce, and just in that same manner of dedication with this new administration. I know that's what you would want, and I know it's what you expect of me. So the same goes for our incredible health director and all of her staff. This is why we're here today. You might say to yourself, what are you so excited about? There's 367,000 of us, and we've only got about 20,000 in town, and this is 4,000. We've got a long way to go, baby. Yes, we do, but we must begin somewhere. Once we use these 4,000 and demonstrate to the state that we are efficient, swift, and competent, we will have standing to ask for the next 4,000 to be sent to us rapidly. So we must be proud, but we also must have humility because we are working for our community and we have so much work ahead. And we've proven that we're up to the task. Our community's health is in our hands collectively. Please do your part. Please join me in our New Year's resolution to stay safe, stay healthy, and stay informed. Now, those were my prepared remarks. I need to add 2 things. One is Health Director, housekeeping. Health Director Rodriguez is here to answer, I would say, your technical questions about the administration of the vaccine. We are going to have an opportunity to do 2 ways of participating in the vaccination. two ways. Pre-registration, we're going to talk about that in just a moment, and on-site registration. If you do not have a computer, a laptop, an iPad, a phone, no mortifiques, don't worry. We're here to take care of you. Remember, the population that we're working with is over 65. And so, for the most part, plus our chronic conditions, we want to make sure you know that we have thought of multiple ways that you can register, including on-site. However, I've already told you day one, how much are we going to be able to do? Only half day. The next day, Tuesday, we're going to do 1,000, and then God willing, we'll do another 1,000 after that. That's 2,500, and another 1,000, and I guess we'll do the 500 the next day. We're going to be there all week. And we're going to do it in a way that paves the way for another 4,000 the following week. Not guaranteed, no guarantee. We've got a lot of challenges as a nation getting this vaccine, but it is the best way we can earn their confidence in getting us another 4,000. So we're going to open up the pre-registration Sunday. Forgive me, can someone tell me the date? The 10th, Sunday the 10th at 5 p.m. And the registration site is both on the City of Corpus Christi's website, the nuecesco.com website. I'm going to give it to you in a minute for the media, but I'm going to try to walk us through it, plus the health department's website. Okay? And we're going to message it like crazy. You're going to help us, media, and we're going to find this way. And this is how we're going to do pre-registration. And when you pre-register, you're going to get a code on your phone. You're going to take that phone and that code to the Richard Borchard Fairgrounds. You're also going to get some instructions. From there, it's easy. You get into the location, you follow the arrows to the Richard Borchard Fairgrounds, and we're going to take you through from there. We're going to have a lot of friendly, informative people who are trained to help you. It may not be quick. In fact, I'm going to guarantee that you're going to have to wait. You're not zipping in and zipping out. So make sure that you've prepared to take some time. Your life is worth it. We are going to do everything we can to be as efficient as possible. Now, the way we have our sign up, for those of you that are going to do it online, it works in a way that after the first X amount of vaccines that we have to offer are assigned to a pre-registered applicant, it's going to stop you. So if you register and it says there's no more for today, that's what it is, but you're going to be able to do it again the next day. However, I've already talking to IT, who's in the room with me, and we're already brainstorming about ways where we can open up registration and maybe give you a number so that you know if your number is between, 1 and 600, you're on day 1. 601 to 1,000, you're day 2. Just know that we are going to do both ways. You can be able to go to the Richard Borchard Fairgrounds at noon if we message that through the media, because again, do we know when FedEx is coming? No. It's just the best guesstimate. So if we start at noon, you can show up at noon, and we will register you on site. Again, there will be a limited amount to be determined by the health director, her staff, and the state of Texas. So, again, who's eligible? Well, if you were Tier 1A, a first responder, a frontline worker, a health worker, an emergency person involved with the transport of COVID-19 patients, you should have already gone. But just like the airplane, if you're on code 2 and you have a ticket that says 1, you can come through. Where we're concentrating right now is over 65 and anybody over 16 with a chronic illness. You are eligible. I want to just look over the website, and here it is for those in the media who are writing this down, www.cctexas.com/ coronavirus. That is the website to pre-register on Sunday starting at 5 p.m. You follow the link, and again, your registration will be complete only when you receive that code, which we call a QR code. And if you do not receive the QR code at the end of the registration, then again, Peter Collins, I'm hoping it says that there are no more, it's going to give you some message that says you do not have a registration, or do they just need to, if you don't get a QR code, you just don't, you know that you're not registered. Yes. Yes. Okay, so that helps. So I asked the question, what happens if there are no more availabilities to pre-register? It's not going to let you do it. You don't have to worry about it, okay? I think finally, again, we're going to do our very best to do the best public messaging that we can, to let people know to have patience. Vaccine is here in our community through a multitude of providers, and more vaccine is on its way to us on Monday, hopefully the fire department very soon, and more after that. How I wish there was one for everyone. It's important that we share our humanity with one another. I want you to know that I'm as worried about my parents as you are about yours getting this vaccine. I'm as worried about my daughter, a cancer survivor, getting this vaccine as you are with your family members that you love and are worried about with your chronic conditions. And that's why I will not rest or sleep. I wish I could stop eating, but somehow that's not working. But I wish that I could have more hours in my day to demonstrate to the state that we need more so that all of us can rest easier. I want to end with that movie, that one I told you about, Mayor. If any of you love that movie, you know there's also a famous line besides, if you build it, they will come. And that is it the reason he builds the Field of Dreams? The reason we built this infrastructure at the Borchard Fairgrounds to accommodate mass testing and mass vaccination with all of the people you see behind us is the same answer that's given to Kevin Costner in the movie, and that is to ease his pain. The only thing I would do is change the pronoun. It's to ease our pain. The pain of COVID-19 ravaging our community and taking over 570 lives from us. So, good news, optimistic, but we need to be thoughtful and patient when you both pre-register or whether you come to our on-site. And again, we're going to defer all the technical questions at this time to Annette Rodriguez. This is the particular vaccine that requires refrigeration, and so there are some important technicalities with regards to the handling of this vaccine. For the media, we will be setting up a media location at the Keach Library. You can conduct interviews there, bring your equipment, work. We're also going to make accommodations to bring you onto the site with an escort so as not to disturb what's going on inside the hot zone of vaccination. Finally, please remember that while we're doing all of this to demonstrate our flexibility and quite frankly our creativeness, we are hosting our Nueces County Junior Livestock Show the same time at the same place. We will do so in a manner that's still fitting for the pride that we also share for these children who have dedicated all year to raise an animal or participate in a project for their future in education in the form of scholarships. So we have an incredible logistics operation going on. I will be able to answer any logistics questions you have. I'm going to also defer to the experts behind me. And at this time, I'd like to bring Annette Rodriguez up to the podium for questions. I'm also available if I have missed something. It's hard when we are unveiling so much at one time, let us tackle the rest individually at the conclusion of this press briefing. Annette?
El lunes vamos a recibir 4,000 vacunas de la compañía Moderna. Lo más pronto posible las vamos a administrar a personas de 65 años o mayores quienes tienen enfermedades crónicas, así como a mayores de 16 años. Tendremos la capacidad de administrar hasta 1,000 vacunas por día, pero lo más seguro es que el primer día no podremos administrarlas todas. Actualmente hemos usado el Centro de Exposiciones Richard Borchardt en Robstown, en donde ya hemos vacunado a más de 500 personas. Quiero agradecer a la ciudad de Corpus Christi y a todos los departamentos, así como a la ciudad de Robstown, que nos han ayudado con la logística. Quiero agradecer también al alcalde y a toda la gente que se ha ayudado a este esfuerzo para atender a nuestros residentes. Yo sé que esto es lo que usted espera de nosotros. Tenemos aproximadamente un 50% más de personas en el estado de Texas mayores de 65 años que el promedio en todo el estado. Tenemos más personas sin seguro médico, así como personas de bajos ingresos e incidencia de enfermedades que hacen del COVID una enfermedad mortal. Recuerde seguir tomando todas sus precauciones, use un cubrebocas, lave sus manos seguido y mantenga su distancia. Nos hace falta mucho por hacer, pero somos competentes y le vamos a demostrar al Estado que estamos listos para recibir más vacunas pronto. La directora del Departamento de Salud nos va a dar los detalles para registrarse, para recibir la vacuna, ya sea en línea o en persona. La preinscripción estará abierta desde este domingo 10 a las 5 de la tarde. Se le va a enviar un código al cual tendrá que llevar en su teléfono cuando vaya a vacunarse. El proceso va a tomar tiempo, así que le pedimos que tenga mucha paciencia. Vamos a hacer lo posible por ser lo más eficiente posible. El portal donde podrá preregistrarse es www.cctexas.com/coronavirus. Para registrarse, va a tener que ir a ese portal. Su registro va a estar ya completo una vez que reciba el código QR o de respuesta rápida, QR code en inglés. Si no hay suficiente espacio, no va a poder inscribirse hasta la próxima ronda.
Thank you. Annette Rodriguez, Health Director. So I'm going to just give you a little bit about the details of how, of what Monday's going to look like. So if we could get our first slide up. So this is our COVID-19 mega vaccine clinic. So it's the real deal. It's the big event that we've all been waiting for enough doses to be able to put on this event that we have been planning, for months now. So where is the event going to take place? And as you see on the slide, it is at the Richard Borchardt Regional Fairgrounds at 1213 Terry Shamsey Boulevard in Robstown, Texas. The time is, we have there to be determined. We are planning for noon, but what the state has told us is that because of weather in different parts of the United States, the vaccines may not get here as early as we are hoping, but we're hoping they get here early enough. And then for logistics purposes, we have to make sure that the vaccine gets thawed out so we can get to Richard Borchardt Fairgrounds and we can get started. But our goal right now is to get started at noontime, and that is Monday, January the 11th. So there is the dual system for registering. Those individuals that have computers, they can register online. We are going to take half of the people that we're going to vaccinate for the day online, and the other half are going to register on site for those individuals that don't have computers, that don't know how to do all of that on the system. We're going to help them right there at the site. So Sunday, as the judge mentioned, January the 10th at 5 p.m., that link will turn on so they can register those first half of the doses that will be given on Monday. And then it'll turn off as soon as they meet that number of people. So for Tuesday, if it turns on Monday at 5 p.m., as soon as 500 people are pre-registered, it'll turn off. So everybody else has to go and get in line, and they'll take the first 500 individuals that are not pre-registered and the 500 that are registered to meet the 1,000 that we are planning on taking care of on Tuesday. We're also going to try to take care of additional individuals if we can, if we're able to, and we're still going strong. We'll go 1,010, 1,020, 1,030. We probably will end up closing around 8 p.m. every day. That's our plan at this time, so we're looking at lighting, a lot of other things that have to be taken into consideration. So which tiers are we doing? So we never drop a tier, we only add a tier. And so we're actually doing phase 1A, which is includes two tiers, Tier 1 and also Tier 2. And I think everybody's very familiar with the Phase 1A, but these are the frontline workers. These are people working in doctor's offices with COVID patients. All of these individuals, if they haven't signed up as providers, they can still go through this process to get vaccinated. So we're definitely taking care of 1A all of the time until all of 1A is done. But we're also taking care of, next slide, the 1B. And this is really the one we're concentrating on, and the state is asking us to concentrate on, because we know that the most vulnerable populations are those over the age of 65. They have poor outcomes if they get COVID-19. So we're really targeting people over the age of 65. Do you have to have a chronic medical condition if you're over the age of 65? The answer is no. You just have to be 65 years of age or older. We're going to take care of you. The second part of Phase 1B is anybody 16 years and older with a comorbidity or a chronic medical condition. So for those individuals, we're taking 18 years and older. And the reason we're not taking 16 and 17-year-olds is because we only have, what we're receiving is the Moderna vaccine. The Moderna vaccine is only for 18 years and older. So we will not be vaccinating anybody under the age of 18. So make sure that you look at that when you're filling out the registration. The other thing is that when you do receive your QR code, so you've registered online and you receive a QR code, you can take a picture of it, so that way when you come through the line, you can show it to us. We can help you with that when you get there as well. What we're going to ask you not to do, what people have been trying to do, is they're trying to share it with other family members, with other people. This is a unique QR code for just you. So my QR code, when I go to the drive-thru, is going to say Annette Rodriguez. So if I share it with 10 family members, every family member that comes in, they're going to say, Annette Rodriguez, you don't look like Annette, you look like a male. And so that's going to cause confusion, that's going to cause problems. Do not share your QR code. That's really important. It's your unique code. It goes with your date of birth. It goes with your screening. Everything about that is just you. So don't share your QR code with other people. And finally, I just wanted to say that we are extremely excited to have been picked as a mass vaccination hub by the state of Texas. We're grateful to them. They could have picked other places, but we have been trying to show them that when we receive vaccine, that we turn it around very quickly. And so they've acknowledged that. We're grateful for it, and we're hoping that we continue to get 4,000 doses for the following weeks as well. I am now going to turn it over to Deputy Chief Richie Quintero. Thank you.
El día lunes la vacunación se va a llevar a cabo en el Centro de Exposiciones Richard Borchardt al mediodía, pero ese tiempo puede cambiar una vez que recibamos las vacunas. Si cuenta con computadora, regístrese en el portal www.cctexas.com/coronavirus, pero para quienes no tienen acceso podremos registrar en el mismo lugar. El día martes también vamos a vacunar. Recuerde traer su identificación y si se preregistró, traiga su código QR o QR Code. Estaremos vacunando a las personas de la etapa 1A hasta que terminemos. También comenzaremos con la etapa 1B para mayores de 65 años con enfermedades crónicas o sin ellas, si es mayor de 65 años. Y para los mayores de 18 años con enfermedades crónicas, ya que la vacuna Moderna es solo para mayores de 18 años. Le pedimos que no comparta su código con nadie más, ya que ese código es personal y no lo podrá compartir. Cuenta con información personal. Estamos muy contentos en poder ser parte de este esfuerzo para vacunar a muchas más personas. Ahora el reporte del subjefe de bomberos, Richie Quintero.
Good afternoon. My name is Richie Quintero. I serve as the Deputy Fire Chief for the City of Corpus Christi's Fire Department. With me to my left is Assistant Chief of Operations, Kenny Urban. What I'd like to provide to you today is a preview of the plan that we've created and are working on in order to assist the Nueces County Health District with the distribution of these vaccines. In particular, our allotment of these vaccines. Again, we showed great appreciation for the opportunity to provide for our community as we share the same passion and are trying to move with the same urgency as those that you've seen come right before me, and definitely an unlimited number of folks that are not represented here today. This is a grand effort by any scale. So with that being said, as was noted a moment ago by Annette Rodriguez, our focus is going to be on those folks that fall under the Tier 1B category. We won't redefine that, as that's already been defined a few times already. But that is our intent. And in doing so, we discovered that we believe the most efficient way to do that, as was mentioned by Judge Canales, is to outreach to those that we've already have registration and information on. Our target is to focus on those that are already receiving senior services from City of Corpus Christi programs. These services are in the form of Meals on Wheels, the Senior Companion Program, as well as the Retiree and Senior Volunteer Program. These vaccines will be provided to these individuals at those senior centers that they receive these services. These are located throughout the city. Some are listed here to my right. The schedule for this distribution will be finalized following a polling that is occurring, or that is beginning today, of these individuals to identify the population, both in numbers and locations, as to who would like to receive this vaccine. We'll also provide an opportunity to, for those that, who belong within this same tier and are not receiving services, to register and put themselves on in that queue to receive this vaccine. We'll use the exact same distribution method using those exact same locations once we have those populations identified. The final schedule, if this comes to fruition, will provide a morning schedule that allows us to provide vaccinations to those receiving city services, and in the afternoons to provide for those that have decided to register and receive this vaccine, still belonging to this particular category. Additionally, we are working and developing a mobile hotshot program or service, pun intended, that will identify those seniors who are homebound and for whatever reason are unable to find themselves to these locations, so that we could follow the schedules such as Meals on Wheels and provide those individuals who are bound to their homes with this vaccine. Again, this is a preview. As you drive around the city and you see locations of construction that state coming soon, that sticker belongs on this plan. As we receive the allocation and we're able to finalize the plan, further information will be distributed. Myself and Chief Urban will be available for questions at the conclusion of the briefing. I return the mic to Judge Canales.
Nuestro enfoque principal es para aquellas personas que pertenecen al nivel 1B, o sea, 65 años o mayores o 18 con enfermedades crónicas. Se comenzará con aquellas personas que ya están registradas para recibir servicios en los lugares, en los centros para personas mayores de edad de la ciudad, a través de distintos programas que son administrados por la ciudad. Se van a proporcionar vacunas a estas personas en los centros en donde ellos ya acuden a recibir esos servicios. También se va a identificar a aquellas personas quienes no reciben ningún servicio por parte de la ciudad para que puedan ser vacunadas. Ahora la juez del condado de Nueces continuará con su reporte.
Okay, there's one, well, everything's related in COVID. This is not about vaccines, but it's important, and the media has been asking quite a bit, and I want to share this with you. After today, and it might be live right now, our community risk dashboard is going live today. I asked him to please see if we could get it done by this press briefing. In order to see it, you're just going to go to, maybe Robert can give me thumbs up. You're going to go to nuecesco.com, just the Nueces Code, www.nuecesco.com. And at the very top, there's going to be like a cheat sheet in the sense of it's going to just tell you community risk dashboard, and you'll be able to click that. It actually just says community risk. So go to nuecesco.com, click community risk in the banner, which is right under the menu, and then you will be able to access the risk dashboard. What is that going to do for you? It's going to give you a color code for your day. Green, yellow, orange, or red. I bet you can guess that green is a good day in Nueces County, and red is an extreme risk day in Nueces County with regards to the spread of COVID-19, as the metric has been calculated, which includes and is not limited to one metric. It's a different set of metrics, which you can see in detail. But of course, it has to do with how many cases we have over the last 7 days on average, and the hospitalizations, and particularly the ICU capacity. So today is an orange day, I have been told. And it's a hot orange, meaning it's trending red. So we need to be mindful about those 3 W's, and I look forward to talking to you more about the dashboard as you explore it. Let me say something in closing about the dashboard, the information that you've heard. We need to be able to keep delivering the best services to the community, and we're going to be able to do that by refining our services and making them better. That means if we see something that we can do better, we're going to do it. We will pivot, we will change, we will make it better for you. Like so many other things in this pandemic, this is a first for us. And so I would ask that you constructively share with us how we can do it better. And we will listen. There is a phone number, 826-7200, option number 2, that you can call. I have seen in other jurisdictions entire phone systems go down because of the influx of calls. If you're the type of person that can get great information on the website, use that as your first portal. If you need to call us, call us. If the line is busy, call us back. If you can't get through, keep trying, and we will make certain that we get your answers that you need regarding this vaccine distribution or the community risk dashboard. We'll be back on Tuesday with the press briefing. I'm going to see most of you on Monday at the fairgrounds, and there'll be ample time for us to talk to one another. Asking for patience is like nailing Jell-O to a tree, right? It's just not that easy during these times that we live in. But sometimes you need to ask anyway, and we need to try our best to have the grace and the courage to give it. So, what questions can we answer for you today? Let me yield the microphone. I didn't touch the microphone, and I've got my mask on, but you're welcome to come and clean. But I just wanted you to know that we're ready for any questions.
El día de hoy contamos con un programa de cómputo nuevo parecido a un semáforo. Se encuentra en el portal www.nuecesco.com. En la parte de arriba se encuentra una barra con un botón llamado Community Risk. Haga clic en ese botón y accesará a un programa en donde se le dará información del riesgo en que la comunidad se encuentra en cuanto a la propagación del virus, así como los pacientes que están hospitalizados. El color verde, por ejemplo, son buenas noticias y así consecuentemente.
Did you have any questions today? Yeah. Oh, con permiso, otra cosa con ese menú. Para la próxima semana vamos a tener ese menú en español. Community Disc Dashboard will be available in Spanish by next week. Thank you. Go ahead.
Okay. My first question is about the website that we're going to be using for people to pre-register.
Yes, ma'am.
Are we worried at all, or have we set up anything in case that website crashes due to a large number of people trying to access it all at once?
Right. So with me here today is Peter Collins, and I'm going to have him come up. He is the Director of Information Technology for the City of Corpus Christi, Mr. Peter Collins. The system that we're using is named Luminaire. It's being used in other jurisdictions across our state, and so we have a lot of good experience with it, and I'll yield to him at this time.
Thank you, Judge. To answer your question, the system has been heavily load tested. It can do millions and millions of registrations. So we have very good, strong confidence in the application and the load and the resources. And there's redundancy built into it too. So if a part happened to malfunction, then another part would pick it up. So we have looked at this, and the reliability is built into the system.
Awesome. Thank you.
You're welcome.
I do have other questions as well. Do you want? Okay. And this might be a question for Annette. How long does it take on average to give out a single vaccine?
Okay, well, that's a great question. So if you're going through our drive-through event, we're hoping that we can get cars through in less than 10 minutes. So again, it depends on how many individuals are there. You know, we've seen nationally, people are lining up the days before. We're hoping that doesn't happen here, but it's something that it could happen. We'll have PDs helping with logistics for traffic control, but we'd like to be able to do them under 10 minutes.
Okay. And with that being said, I just want to ask again, and I think you addressed this a little bit earlier, but what are some of the reasons for the limit of 1,000 vaccines per day?
Oh, it's just basically a logistics. It's the vaccine itself is a very fragile vaccine, so we have to have data loggers that actually tell us what time they take it out of the freezer, what time they put it into the refrigerator, how long it's been in the refrigerator, how long it's been in room temperature, how long it takes to actually draw them into the syringes. We have to have them drawn in time for when the lines start coming through. They're in vials, and so we draw 10 out at one time. Sometimes we get an 11th dose. So it's really just logistics, and then the number of people that we have vaccinating. So we have 15 vaccinators ourselves, but we also have 65 students on standby that are also going to be helping us with vaccinating as many people as possible, as well as now we kind of, like the judge mentioned, we have the livestock show that's going on. So we're working kind of with a dual system here. And so the size, the capacity, the width band, but we're working through all those things. Once the livestock show is finished, we'll be able to do this much different, and it'll be a set pattern. The direction that they come in and the direction that they exit will be set every time. But this first week and next week is just going to be a little bit more challenging, but we're up to the challenge.
Awesome. And then I think there's been a little bit of confusion on if this number that we're receiving now will also be a part for the people who are still waiting to receive their second shot of the vaccine. Is this number, the 4,000 vaccines, completely available for first shots? Can people who need their second come through the drive-through this week?
That's a great question. So the health district, their second doses, when we started vaccinating, the second doses is not due until after January the 20th. These 4,000 doses are specifically for first-time, first dose people, recipients at this time.
Awesome. I think that's all the questions I had. Thank you.
Annette, will you address the 15-minute wait time? That also contributes to the time involved.
Right, and so what I gave you was, there's that, they're coming through, they're getting registered, that might take a few minutes, they're going over to the vaccination, they're getting vaccinated, and they're done, and they're at the adverse reaction site. That's definitely a 15 minutes added to that time. They have to wait the 15 minutes. We have fire department, EMS, paramedics there just to make sure that nobody has an adverse reaction within those 15 minutes. If they have a severe allergic reaction to vaccine or vaccine ingredients, then they sit in a 30-minute adverse reaction line. And we monitor them for 30 minutes to make sure that they don't have any bad reaction to the vaccine. And so that would, be different from the time that I gave you, an additional.
Pues Canales, ¿podría expandir un poco en el sistema del dashboard para la comunidad hispana?
Sí. El dashboard la tema es comunicación. ¿Cómo podemos hacer la explanación? ¿Cómo sentimos en el condado de Nueces con COVID-19? Empezamos pensando que la cosa más básica es hacer el ejemplo de colores. Vamos a suponer que el día es verde. Verde quiere decir que vamos a estar listos a estar afuera de nuestra casa, ir a restaurantes, tiendas, lo que sea. Listo quiere decir que estamos muy bajos en las causas positivas de COVID-19 y también las causas en el hospital y también en el cuidado intensivo. Amarillo quiere decir que es un nivel más alto, que deberías tener precauciones. Naranja, súper más alto que amarillo, quiere decir tienes que tener más vigilancia en sus actividades. Y rojo es el más extremo. Quiere decir que nosotros tenemos un problema grande en nuestra comunidad. Por ejemplo, las camas de cuidado intensivo están llenas Y estamos al máximo, ¿verdad?, de capacidad de nuestros hospitales del condado. Y queremos decir esto para que nosotros podamos acomodar cómo estamos portando dentro de nuestras familias, familiares, organizaciones y eventos. Yo espero que esta es una comunicación que puede ayudar a todos a saber cómo estamos cada día. Es muy similar de otros temas de comunicación del aire, también, por ejemplo, de la contaminación del aire. Hay muchos instantes de estos tipos de formas de comunicación. Yo espero que esta comunicación vamos a tenerlo en el web de nuecesco.com en español muy pronto. Hoy, primeramente, está en vivo hoy en nuecesco.com y para la próxima semana la tenemos en español. El métrico que usamos viene directamente de los hospitales y del Departamento de Salud y esperamos que te ayude a saber qué está pasando si no estás en comunicación cada día con médicos. Y ojalá que nosotros podemos pensar de nuestras actividades y el color que estamos en ese día particular. Gracias. How did I do, Gabby? I need more practice.
I have a question, actually a bit of a clarification. I was just wondering, generally people have been told that you guys wouldn't know when you were receiving the vaccines until about like 12 hours beforehand.
Right.
What's the difference between that and you guys already knowing?
Gosh, that's a great question. I'm so glad you asked that because you brought up a super important distinction. So the way we had been working since December 19th, okay, was off this 12-hour notice. And here's the strange thing. We're still going to be working off that 12-hour notice as it applies to us. It's either CCFD or the health department. So we're actually still expecting doses to come to us at City County Health on that short fuse time period. This mega site is meant to support a region. By the way, if you Google throughout Texas, you're going to see these mega sites are occurring in Houston and Dallas. I know I've read those too. So we're one of those, right? So what we're supporting here is a regional effort. So your media coverage is greater than Nueces County, and we expect that people will come to us from outside our jurisdictional lines as well. I haven't had the opportunity to pick up the phone and call all my county judges, friends that are around us, but I started yesterday with Clayburgh. I'm going to be meeting in this chamber with Judge Krebs at 2 o'clock. We're going to be sharing information. This is a regional hub whose doses are expected to serve a coastal bend region. Very different setup by, as I said, Texas Division of Emergency Management, whereas our other 12-hour notice is again, on that short fuse. And what I'm excited about that, if we want to take it one step further, is that when CCFD gets theirs, it's kind of that short fuse too, okay? And I know because we're fielding a ton of phone calls. What about, a certain group of folks? Let me give you a great example. Our bus drivers. How important is it to have transportation in a community? It's everything. For low-income communities, it's huge. I've got to be able to address the need of taking care of our frontline workers in a different way in transportation. And I'll be able to do that when I get certain allotments where we can target. Same thing with our teachers and our staff at our schools, right? But the state of Texas doesn't tell us, Barbara, in fact, they absolutely tell us the opposite. They don't let us have categories except for the what's have been listed here for you. But here's where we get some flexibility, that local control. When CCFD gets their allotment, they've made a really good choice that we're going to target these seniors who are already receiving city services. When we get ours, I might want to visit with public health and say, I'd like to target CCISD and other ISDs, not just CCISD, but the ISDs, right? And potentially transportation workers, so that we can, focus on that. But that's that 12-hour. So what we're hoping is if we do our job well, there's a lot of pressure on us to do it well. That's why we spent all day yesterday at the fairgrounds. We're going to have earned that trust, and we're going to continue, and it'll be more consistent and not so short fuse, 12-hour, here they come. Does that make sense? And be good to message that. We're still going to keep pushing for our, I want to call it, how would we call that? Our local allotment with the other 80-odd providers in our community. And the other thing is we're also supporting logistics for other providers. So our federally qualified health center, Amistad, once they finish their vaccinating their patients, and we're going to support them in that effort, they will also help us with vaccination too. So as allotments keep coming to individual providers, of which we're one, we're going to keep vaccinating. But this mega center, the goal is, cross your fingers, we keep getting a consistent rotation. Because why? We're not just serving Nueces County, we're serving this regional hub. Okay?
Just to clarify on that, like we can expect to maybe see even more vaccines come into Nueces County aside from getting that
Yes.
4,000 maybe every
Yes,
week
ma'am.
that continues?
Yes, ma'am. Just this morning, you know, we're looking at, there was a survey that was given out to providers asking them if they can handle more. And our message to providers, if you're listening, is yes, you can, because we're going to help you. We're going to be here to support you in logistics. Sometimes I think to myself, I wish I could help more, but I'm not a doctor or a nurse. I'm not able to do what Annette can do, but I can be the logistics czarina, I guess. But we can do that in a way that we promote more allotment coming to our providers. And we haven't even begun to see CVS, Walgreens, HEB really come into full force either. So yes, you can expect to see more. This will not be our only, which is why we want people to take that deep breath and say, it's coming, right? Awesome. Yes, it is awesome. Thank you all so much. Thank you all.
If there are no other questions, that concludes our 11:30 press briefing this morning. Thank you all for being here. Thank you for helping us to get this information to the community. And I'd be remiss also if I didn't say thank you to the mayor for his leadership. The role that he's played in the COVID-19 pandemic has been phenomenal. His love for this, for the citizens and for this city, his passion is just amazing. And I'm proud to have served under him. So thank y'all again, and we'll be back next Tuesday at 5 o'clock.